By Executive Order N-2920, issued on March 18, 2020, NMUSD board meetings will be closed to the public. Spanish interpretation will be available via the Zoom link. Good afternoon, everybody. This is a special meeting via teleconference. We are only meeting remote. We've been meeting in person. The only reason we're meeting remote is it was a last-minute called meeting, and our boardroom was previously occupied. So we wanted to make that clear to everyone. And I just wanted to make a statement before we start. This is not a meeting any of us wanted to have. There are comments that have been coming in, some of which have indicated that people felt we were sneaking this meeting in at the last minute before our break, so parents wouldn't know about it, wouldn't be discussed. And I can assure you that is not true. What we're going to be discussing today, we first heard about Tuesday night after our board meeting was over. We were then told we were given some data points about what is happening specifically in our district that is causing us issues. So in reality, our superintendent had the capability of making a decision having to do with COVID-related issues, which this is, but our board decided as a whole that we wanted to be part of that. We wanted to hear the information, we wanted to hear the data and be part of making that decision. So that's why we are here tonight. So now we will have roll call. Rosie, would you like to start that?
Thank you. Trustee Yelsey?
Here.
Trustee Barto?
Here.
Trustee Matoye?
Here.
Trustee Anderson?
Here.
Trustee Crane?
Here.
Trustee Ersoylu?
Here.
Trustee Weigand?
Here.
Mr. Lee Sung?
Here.
Adoption of the agenda. Do I have a motion?
I move to adopt the agenda.
Is there a second?
Second.
Moved by Trustee Barto, seconded by Trustee Weigand. Roll call vote.
Trustee Yelsey?
Yes.
Trustee Barto?
Yes.
Trustee Matoye?
Yes.
Trustee Anderson?
Yes.
Trustee Crane?
Yes.
Trustee Ersoylu?
Yes.
Trustee Weigand?
Yes.
Next, we have community input on special agenda items only. For the record, we have 278 comments today, including some duplicates. We will take the first 35 comments for 6A, threat to public services or facilities. We will then be going into closed session. When we come out, we will take the other comments having to do with item 7A, approved temporary shift to distance learning. Because we have many comments and we do want to have discussion, I'd like to limit this to 20 minutes per topic. So before closed session, we'll take 20 minutes of comments. When we come back in, we'll take 20 minutes of comments. We want everyone to know that we have received all 278 of the comments and have looked through every single one of them, and they will all be part of the public record. So Trustee Matoye, would you please read the statements?
President Yelsey, if I may just add one, I think, very important piece of information for everybody to know, that the public comments that are received are randomized. The order is randomized. So if we do not get through reading all of the comments in the given time period, it is based on a randomization.
Good point, thank you.
Before I start reading, there was a comment for Mrs. Amescu. So Mrs. Yelsey, when I'm done reading, will you let her know in the chat? This is an opportunity for the public to address the board regarding items of the special meeting agenda only. Each speaker has 3 minutes to address the board, unless we're changing it. Per board bylaw 9323, there is a maximum of 20 minutes of comments per topic. With board consent, the president may increase or decrease the time allowed for public comments depending on the topic and the number of persons wishing to speak. In the event The number of submitted public comments for a closed session item are anticipated to exceed 20 minutes. The order of comments will be read in random order until the 20 minutes have expired.
Okay, we're changing that to 2 minutes per comment. Most of them can be read within that time anyhow to get more of the comments in. Okay, Ms. Anderson, would you like to start?
Yes. The first comment is from Katie Riccio. I am writing to ask the board to consider approving a temporary shift to distance learning for all schools in the district. The elementary school where I work has a current COVID positivity rate of 1.7, which is a higher positivity rate than all of the secondary schools in the district. Over the last several weeks, we have had many staff members and students out quarantining due to positive COVID tests or direct exposure. As a result, I have had to cover classes for other teachers due to a lack of available substitutes district-wide. This is a safety issue for the entire district, not just secondary schools. I believe that it is in the best interest of students to learn in person. However, the COVID rates in Orange County are soaring, and staying open, even in the hybrid model, puts students and staff alike at a higher risk for contracting the virus. Allowing elementary schools to temporarily transition to distance learning is one way that Newport-Mesa can help slow the spread. Orange County is currently experiencing high rates of positive tests, hospitalizations, and death following Thanksgiving gatherings and travel. My colleagues and I are worried about that these spikes will continue following the late December holidays, as many students and their families are traveling and are choosing to gather with people outside their immediate family. Please keep those of us in elementary school safe too.
My comment is from Donna Hunt. Why is it the middle and high school will be staying home after the winter break, but elementary, both general ed and special ed, have to return? Please don't just consider the students, but also consider the staff, and that we will be at risk during the time when hospitals have reached their capacity and that virus is at an all-time high. Please, I would ask the board to reconsider keeping elementary schools open in January. Thank you.
Apologies. I don't understand why myself, a mother of two beautiful humans at age 11 and 6, who are home safe with social distancing at home alone without supervision, because I myself would never throw my human children into a brick and mortar school that is a prison. Elementary schools are exempt, while one coworker in the classroom I work in was exposed. I was exposed, got sick, and got my two children sick. It's a ripple effect if you ask me. I realize that a high school is larger, and that is why they will go into distance learning. But has anyone in the union come into any special day classes to really observe what I actually do? Change diapers with spit on my face all the while. Excuse me. I'm trying to. 1 second, please. Who's that on? 1 moment, please. All the while, another student runs away. The truth is, the only reason why I still work here is because this is the only reason, because I have health insurance. The job is bad, and I pray every day I will get fired. That way I can go about my life and just get insurance through my husband's job. What will happen when it starts to rain? Where will I eat? In my car? Because that is where I have to eat now. There isn't a sink in my car. When it rains, I'm so excited to run to my car in the rain and imagine me falling and hitting my head the same way Debbie Kendall fell at Newport a few years ago. I pray every day I will win the lotto that way. I don't have to be jealous that the office manager gets to sit alone in her office while I have to drool, while I have drool all over my eyes.
The next comment is Pam Saunders. Good evening, Board Superintendent Lee Sung, Cabinet, and guests. First, thank you for this opportunity from CSEA. CSEA supports the superintendent and board in returning to distance learning for an extended period after the winter recess. However, we request that you also consider a return to full distance learning for our elementary sites as well. This is a matter of safety for the students and staff as COVID-19 cases skyrocket around the county. CSEA also encourages allowing employees to work remotely during this time of uncertainty. CSEA is committed to supporting the students of NMUSD for in-person education. Unfortunately, it is just not safe for students or employees to be present at this time. ICU beds in Orange County have reached 0%. It is now more important than ever to keep students and the workforce safe. Again, thank you, CSEA Chapter 18.
Newport-Mesa employee. Mr. Lee Sung, during a COVID board meeting early on, you stated that your leadership would be guided by science. Your words held such significance with us. But now when our community-wide COVID statistics are at record highs and after the impacts of the political pressures that are relentlessly being directed towards you, it is now incredibly disheartening to see you pivot to a legal clause to justify your current decision-making. I do acknowledge that you are in an extremely challenging position. Mr. Lee Sung, in my past encounters with you, however brief they were, you appeared to be a person of high moral character. The active shooter classes and the disaster preparedness workshops that you chaired with all employees provided all of us a glimpse into your character and authenticity. Your stock price among staff rose significantly as a result. But now, the staff that you inspired then and now lead cannot alter your employment status or paycheck due to the political popularity of your decision-making. Unfortunately, the people and groups that do have this control over you seem to have displaced your integrity. For the sake of the hundreds of lives in your district that are at the mercy of your decisions, please chart a new course. Bring back the old Russell, if he was ever there to begin with. Please make different leadership decisions to keep us safe. And in exchange for saving our lives, if your decisions cost you your job, my family will make room in our home for you and your family. Be on the right side of history, please.
Jennifer Whitley. For the safety of myself, my family, and my students, I am asking that school be temporarily online when winter break is over.
My comment is from Melissa Barnes. The children need to be kept in school for their emotional and physical well-being. Please keep the children in school.
My next comment is from Debbie Jensen. My student is struggling with the hybrid schedule and switching to distance learning will be worse. When will you guys take into fact that you are responsible for the education of students and stop playing on the political agenda?
My comment is from Karen Cook. I am really sick and tired of fighting to keep our high school kids in school during this time. Cases at school are low and the virus is not spread at school. The teachers will be safe and school is essential. Learning is imperative. Stop this nonsense now. We have all the PPE and procedures in place. Do not rob our children of their right to in-person education. Online education does not work and they are suffering emotionally and mentally. You will see more mental illness than deaths from COVID. Be brave and carry on.
My comment is from Trish Mathis. Please vote no to return to distance learning for the first several weeks back to school in 2021. Please stop giving into the teachers' unions and review the data, science, and facts. NMUSD COVID data for secondary schools. 79 COVID cases for all, includes staff and students. 9,939 total staff and student population. 0.00794849 proportion of population. 0.7% positivity rate of the school population, not necessarily with any symptoms. Per the CDC, a normal flu season would see between 500 to 1,100 tests positive at NMUSD secondary schools. NMUSD is so far below the normal flu positive rate. NMUSD parents, students were told we would only move back to online if school population had a 5% positivity rate. Every year, the flu season spikes beginning November, peaks in February, and decreases early April. Data facts from the CDC. Currently, COVID cases are far below the normal flu season numbers. The CDC has published that between 5% to 11%, that would be over 400,000 in California, kids are not learning in the current distance learning environment. Teachers are coasting and telling kids there is no need to have a Zoom meeting and to review the homework posted. Teachers are dismissing Zoom meetings as soon as attendance has been taken. Kids are calling other students to try to understand what the homework is about and how to actually do the work.
Trustee Crane, that is the end of the 2 minutes.
Thank you.
My comment is from Krista Guy. As a first grade teacher, I would like the board to reconsider our return to school in January 2021. As we know, COVID cases are currently rising and we are facing the winter break when families gather together to celebrate the various holidays. Past holidays have had a surge that follows 1 to 2 weeks later, which will be around the return of students to our campuses. We are already experiencing students out of classroom for 10 days. If you would let us go to distance learning in January, we will have the time to prepare our lessons and send home materials. We will be protecting students and staff.
Concerned citizen and teacher says, absolutely, students in secondary schools should move to distance learning and probably further than January 22nd. Can't believe it's taken this long to consider this. A cohort in secondary is anywhere from 10 to 20 students mixing and mingling with persons from outside their household 6 to 8 times across the school day. That is unconscionable in a pandemic such as we are in. To top it off, the rosy picture presented is not true. The kids do not social distance at break or lunch and often move out of sight on fields taking their masks off. Finally, the communication of exposure as well as testing and tracing is abysmal. The dashboard is completely inaccurate. I know this. I am a teacher at one of our secondary schools. Please do what is right for all now.
My comment is from Taylor. I am a teacher in the district and have been for the last 12 years. I have seen the difference in the way elementary teachers are treated as martyrs, while secondary gets treated much more as professionals. I taught in secondary for 3 years. This difference could not be more apparent this year. We are paid the same, went through the same credential process. The age of my students should not impact the professional courtesy or way I am treated. We are a K through 12 district and we should be united in that, not divided. In addition, specialists in elementary school were allowed to stay virtual, do not have to do grades or attendance while Zooming the same way we did. This is ridiculous. We are all paid the same and of the same profession. If elementary stays, we deserve hazard pay. Thank you for your consideration.
This comment is from Stephanie Hopkins. The job of a teacher is just as essential as the job of a doctor. In-person learning and being present in the classroom gives the child purpose and accountability. Majority of students need this in order to effectively learn the material being taught. The at-home teaching does not serve the best needs of the students. If students are being put first, then the best place for them is to be in school.
It keeps going off and on. Okay. My comment is from Rachel Duffy. Please keep our children in school. Their mental well-being is at stake. I'm not concerned about my child getting COVID, but rather feeling suicidal.
My comment is from Amy Ivy. There is zero scientific data to support the closure of secondary schools. The schools have done an excellent job staying open so far, with almost no, if any, spread of COVID, and there is no justification for their closure some 2.5 weeks from now. If teachers don't want to teach, they should find another job. I will fully support any initiative that would allow teachers to receive the vaccine as soon as possible. Quit messing with the education and mental stability of these children.
My statement is from Kay Danielson. Although it seems the board have already made their decision without parent input and with heavy pressure from the teachers union and media, it is a very one-sided, no data or science to substantiate the decisions to move to full distance learning for the first weeks of January. See information related to 100% ICU capacity for flu season January 2018 attached. See flu season data from CDC website. Our kids are already suffering from the current hybrid learning. The only time the kids feel like they actually learn something in their class is the 1 day a week that attend in-class learning. Now the school board has given in to the teachers union to allow them to dictate how to favor the teachers yet again. We hear first hand, the teachers telling our kids that there's nothing to do today and dismiss them as soon as attendance has been taken. Little to no guidance on what to do or how to do it. Another day, week, month, year wasted for our kids. Every year, the flu season spikes beginning November, peaks in February, and decreases early April. Data facts from the CDC. Currently, COVID cases are far below the normal flu season numbers. Please, school board, do some of your own research before making a decision. If you pull the information directly from the CDC data website, there is no issue with the current COVID flu. I am willing to show each and every one of you how to dump the data into a spreadsheet and loom at the numbers yourself, instead of relying on the media that provide incorrect facts to fit the narrative. The teachers union uses the media information to their advantage. Shame on all of you. NMUSD COVID data for secondary schools. 79 COVID cases for all, includes staff and students. 9,939 total staff and student population. 0.00794849 proportion of population.
Trustee Crane, that's the end of the 2 minutes.
And this is from Bridget Gaffney. Please keep the schools open. The kids are not learning online. There is more damage being done to these kids by keeping them home. Newport Harbor has done a good job creating a safe environment at school. If everyone wears a mask, attends class, then leaves to have lunch, kids will be better off than sitting home on Zoom. There's also no consistency, and that should be put in place. Giving kids the option to take tests in person or home is not consistent. The fact that kids are switching to cohort C to take finals is ridiculous. Teachers need to be consistent about that. Choose all in class or all online for testing, but don't give kids a choice. The teachers should place more emphasis on making sure kids are grasping the concept as a whole and less on testing.
Anfam says, I fail to understand the necessity in having secondary schools be distance learning. Coming back from winter recess, but elementary schools are exempt. We believe we should all be distance considering the high percentage rates of positive cases in comparison to secondary schools, or at least implement actual hybrid classes for special day classes.
My comment comes from Tammy L. Cabathan. I strongly suggest that all schools be closed for a temporary amount of time until the COVID numbers are manageable. The Channel 5 KTLA News reported this morning, December 17th, 2020, that 1 in 8 COVID test is positive. They also reported the governor is ordering temporary morgues and 5,000 body bags to distribute because we know that when the hospitals are full of COVID patients, the next thing to fill up is the morgues. Whether or not scientific studies suggest that elementary school age children are passing the virus or not, we know that adults do. I spend more of my day as an elementary health assistant for NMUSD with other adults in the office, communicating with teachers and meeting parents to communicate student symptoms. I am not only concerned that kids often have the virus and are asymptomatic, but I am being exposed to many adults each day. My health office restroom is the additional staff restroom. I have adults coming through my office all throughout the day. My main concern is the numbers going up and the impact it has on the public health resources. Having schools open is being said that it is not contributing to the spread of the virus. If this was true, we would not see the number of cases growing in the schools. According to my personal calculations and spreadsheets I created, NMUSD numbers have doubled each week. Each day, the numbers are increasing. To compare to the all of Orange County school districts that are open and posting a COVID dashboard on November 9th, 2020, all the districts in Orange County had 99 cases, NMUSD having 22 of the 99 cases. That is about 22% of all Orange County public schools cases coming from NMUSD alone. That week, OSHA posted 176 cases, which include all public and private. The OSHA
Trustee Weigand, that's the end of the 2 minutes.
My comment is from Diane Elizondo. California COVID-19 data is staggering. The number of students infected with COVID-19 is well on the rise. It is a danger to all members of the school community and the community at large. Newport-Mesa is no exception. Just as you determine that the rate of infection mandates a temporary closure for the secondary and secondary special education, you, the district, also need to weigh the same factors of exposure to COVID-19 at the elementary level. There should be a closure for the winter month, as you will see a steady decline of enrollment.
Trustee Yelsey, that's the end of the 20-minute time period.
Okay, thank you. And please know, for those comments that were not read out loud, we all have them and we read every single one. Mr. Lee-Sung, would you like to say anything before we move into closed session?
I'll reserve my comments for when we go back into open after closed.
Okay. We will now move to closed session. The item is 6A, threat to public services on facilities. We anticipate that we will return to the same open session in approximately 45 minutes. So at that time, right now, all board members will log out, log into closed session, and we will be back into this webinar afterward. Thank you. Thank you. We are back to discussion action item, and the discussion action 7A is approved temporary shift to distance learning for all secondary schools, grades 7 through 12. Before we have the presentation, we will read comments. As I mentioned earlier, before we went into closed session, we have 219 comments on this item. We will read for 20 minutes. And by that, we will limit the time per comment to 2 minutes. So is Trustee Anderson here yet?
No, she's not in yet.
Okay, I will read the first comment since I'm last. The first comment is from Jennifer Schulman. I do not agree with the shift to distance learning. The district has spent so much money to set classrooms up safely to teach during a pandemic. How many pediatricians, health officials, statistics, etc. do you need to say the safest place for children is in school for you to make the right decision? Children are not at risk and are not super spreaders. You have zero scientific data to support this decision. Send kids home, cut their sports, and prepare them to suffer depression, suicide, physical, sexual, and mental abuse. I'm disgusted that school closing is even being considered.
My comment is from, sorry, we're on page 14. Let me move forward. My comment is from Jennifer Atkins. I would like to make a comment from a teacher's point of view. I am a special education teacher for students with moderate to severe disabilities at the secondary level, and teaching and learning in person is what is best for all students. I understand the increase in cases is a concern, but I also believe that kids are safe while at school. At school, wearing a mask is mandatory. If staying at home for the next 5 weeks, masks will not be worn, and with the shorter distance learning schedule, students will be more inclined to socialize outside of the home. Estancia High School, as well as the rest of the secondary schools, I am sure, have worked extraordinarily hard to ensure that staff and students are safe while at school. And more specifically to me, the students in the moderate severe special education classroom are more comparable to an elementary classroom because they remain in their room as a cohort and don't change classes. We have plexiglass, the kids keep their masks on, and we are practicing social distancing and personal hygiene. Please, I urge you to keep kids in school. Being in school what is best for them, and after all, isn't that what we all got into this business to do?
My comment is from Andrea Parks. Dear board members, just yesterday I wrote you about keeping our students in school on Wednesdays, and now I'm writing again regarding secondary students. In the board meeting on the 15th, we learned several things: that there's strong support in the community to have as much in-person instruction as safely possible, and that the district, despite having significant expense growth, has been able to put an additional $9 million into the general fund, growing the general fund to higher than it has ever been. We have done an excellent job of keeping the infection rates far below 1%, and federal and state additional COVID funds, along with a multi-million-dollar increase in property tax revenue, has buoyed the district's fiscal health. If the district is truly having trouble finding the number of substitutes needed, I'd like to see us consider other creative options to grow the substitute pool including but not limited to offering a doubling of our sub-pay rate for the next month or two. It is important for our students' mental and physical health and educational rate of learning to keep them in person as much as possible. This is the rainy day to use part of these funds to make a choice for the good of the students.
This comment is from Scott Campbell. I watched the entire board meeting regarding the delay to reopen the schools. There was lots of emotion expressed, but very few facts were presented. I see no presentation of facts in this motion. Is the board considering the fact that the infection rate, according to CDC, in school-aged children is very small? Since schools have reopened, with tracing, we know no infections occurred in the school. In Tustin Unified, they proved that all infections occurred outside of school. Since school is about educating the kids, we need facts about distance learning. For example, what were the average grades for students, not by grade, pre, post COVID? My understanding is the grades are shockingly poor, not just here, but around the country. Why is the board recommending distance learning when the facts will show it is an abysmal failure? And when data provided by the CDC shows the school-aged children have a very low chance of infection. Additionally, the president and president-elect have declared schools must remain open for the benefit of our kids. Legislation AB 10 has been introduced in Sacramento to force schools to reopen. Why is the board moving against what the people and elected officials clearly want? The grades and test scores, which are how schools are measured, show that distance learning is a failure. And by pushing it, the board is failing its primary duty to educate our kids.
This comment is from Kevin Fairfax. I do not agree with this shift to distance learning because I agree with Superintendent Lee Sung's email to parents on December 7th that stated, the NMUSD COVID-19 dashboard publicly reports positive cases for both students and staff. The dashboard demonstrates that the total number of cases is below the 5% threshold that would trigger a school to consider a move to 100% distance learning under the California Department of Public Health requirements. For secondary schools, we are currently at 0.8%, which is significantly less than 5%. The December 7th email also, I strongly believe what students need most right now, in addition to quality instruction, is consistency, routine, and support from caring adults. A sense of normalcy, which our schools are providing. Please stay with what was stated on December 7th, 10 days ago. Nothing changes until cases are at or approaching 5%, and the superintendent has stated that he strongly believes that the kids should be in school for their well-being. Thank you.
My comment comes from Julie Smith. I am an elementary teacher in the district. If you perceive a danger to secondary school employees and students from COVID and you are recommending distance learning in January for them, I feel that elementary should also be given the same protection. In looking at the district current COVID cases, lists many of the elementary schools have a percentage portion higher than some of the high schools. Do I want to go back to distance learning? No, but I value my life and my students' lives. If having those few weeks not in school can mitigate some of the spread after the holidays, I am all for it. I hope you do the right thing to protect all of your employees and students.
My comment is from Nancy Vaughn. Please allow our secondary students to continue with the current hybrid schedule. My student is just starting to recover emotionally from being out of school for so long. The cases at the high school are low, and the downside for our students of not attending school to interact in person with their teachers and peers is damaging.
My comment is from Jocko Vlock. I do not support distance learning. This should be a choice for each individual household and not a mandate. Worldwide research shows that children are less susceptible to infection than adults. Brown University has done a study, and among 20,000 students and 60,000 staff who returned to school, there was an infection rate of 0.13% among students and 0.24% among their staff.
My comment is from Brent Hemhill. I agree with the shift back to remote learning. I sit on a board with a doctor that is a consultant to the NFL. His analysis starting back in March has been right on. We heard from him this past Tuesday, and it is not looking good. We are going to have a double spike due to Christmas and New Year's gatherings and travel that will not decrease until February unless behaviors are drastically changed. Recent history suggests that behaviors are not going to change.
My comment is by January Von Luft. Please do not close in-person school for grades 7 to 12. Cases at schools in NMUSD have been low overall, and the price is too high from a mental health perspective. I understand we must manage risk, but there is tremendous risk of depression in our children who are expected to stare at a computer all day without human interaction. The private school students are managing in-person schools successfully. Keeping our kids home would further widen the gap in education and mental health. Our children need in-person learning to be successful. If people are concerned, they have the cloud school. For those of us who know our children need in-person, this is our only hope. Thank you.
This comment is from M. Sharp. If this motion is approved, there will be no guarantee that our students will resume in-person learning or activities after January 25th. The stop and start and false promises are not fair to our students. Their education is at risk, as is their physical and mental health. Keep our children at school and please don't take away their activities. They are at very high risk with possible lifelong consequences if we take away what little normalcy they have. I think that all of us, parents, administrators, and teachers can agree on one thing: teachers are essential workers.
Leslie Johnson states, the highest rate of COVID positivity in our secondary schools is 0.02%. This COVID dashboard, along with other safety protocols, was implemented to support our children's in-person return to a safe learning environment. By all accounts, the data reflects that it is working. At this point, even the CDC is recommending in-person learning. So now we are shutting our schools down based upon future fears of numbers that haven't even happened, while ignoring our own data that points to our success. Why? This decision ignores data and it ignores the best interests of our children. I also feel that it is inappropriate for the district to mandate the teaching of suicide prevention courses when it is evident to me that our children's mental health is not truly being considered.
My comment comes from Tamara Fairbanks, NMFT president. In Orange County, we have 607 new cases of coronavirus in ages 0 through 17 as of yesterday. Throughout our secondary schools, we have seen many close contacts where students had to resort to being in quarantine for 2 weeks, some for multiple times. Like many of our surrounding districts, we need to see the scientific data and how that is reflecting on our district resources. When you have critical personnel that are necessary for COVID mitigation now in quarantine, it is necessary to evaluate the safety measures we have in place and go with the best solution that will aid us to best continue without a revolving door of classes shutting down on and off. This past Tuesday was the deadliest day of the pandemic in California's history to date. 295 Californians lost their lives on a single day, tragic proof that we are in the midst of a surge that shows no signs of abating. Our state has experienced over 21,000 deaths and over 1.6 million positive cases, and the numbers continue to grow. Trustees, I ask you to look at the scientific data and make a decision that is based off the public health of our communities. We all want to be in school safely. However, the pandemic proves to us it is not safe. It is not a safe time to be in close quarters with each other. We are urging you on behalf of our coworkers, the families of our coworkers, and the nurses and doctors on the front lines to vote on the temporary shift to distance learning. As you vote for our secondary students to distance learn, please know that we do have the same crisis at the elementary level. A complete mitigation of the disease should encompass a solution for all students and families in our area to have the most stringent safety measure. Although elementary is not being discussed, please look at the impact that this disease has on our West Side families, including the multiple amounts of quarantine and absences, and find a solution to make sure that all kids can have the extra measure of safety. We are urging you trustees to look at all the data to make a determination on behalf of safe schools.
My comment is from Kara Kipp. Pediatric case counts remain low, and the district has taken all necessary precautions to make the learning environment safe for students and staff. Many students need the opportunity for in-person learning, as distance learning is not effective for them. My middle school son is in the high-risk category for COVID. However, he also struggled during 100% distance learning. With hybrid learning, he actually feels like he is learning now. That in-person connection is critical. His self-esteem and interest in school has increased significantly.
My comment is from Michelle. As a district employee, and more importantly, as a parent of a senior at CDM, I urge you to approve the recommendation to shift back to temporary distance learning in January. My son prefers in-person to distance learning, but he even says that nobody is at school anymore. Parents are keeping their kids home, opting for the cohort C. His finals had 3 to 4 kids in each class because parents were given the option to keep kids home. The parents who fought so hard to get everyone back on campus are now keeping their kids home, and those who weren't ready to go back are now suffering. Too many families are still traveling, gathering without masks, etc., and the increase in positive cases within our district is climbing at an alarming rate. Teachers and staff are also gathering and continuing to come to work. A few weeks at home is better than more lives lost when it could have been prevented.
My comment is from Christy Lapel. Please do not switch students to district learning, elementary or secondary. My students need to be in school for the academic needs and mental health needs. These students are the quiet victims in this situation, unable to speak for themselves and with few legal rights. Please don't take athletics from these secondary students. This is all some of these kids have that is not taking care of siblings or trying to help a family survive financially. It's time to listen to what the kids want, not just a few, but all of them. We are failing them again if we move back to distance learning.
This one is from Veronica Perez. This is scary. Our school alone is down to 2 custodians working day and night because the rest have either tested positive or have been exposed along with 3 teachers. Our school/office has not been kept clean per CDC. There's a staff member that says he sees students not social distancing in large groups, not wearing masks, and our admin doesn't say or do anything. For the safety of all staff and students, we should all remain distance learning, remotely work from home. Please care about us.
This comment is from Quinn Corbett. Please accept the recommendation of at least temporary return to distance learning in January. Since Thanksgiving, I have had numerous students out either sick themselves or living with someone who is sick. Many also seem not to understand the rules at all. One student told me that his mom tested positive and that if he tested negative over the weekend, he would be back in class. I had to say that if he is living with someone COVID positive, he absolutely must not return to campus, negative test or no. I have students flying all over the country over Thanksgiving. There will be immeasurably more travel and family friend contact over winter break, including up through New Year's Eve, a mere 3 days before the return to school. Have you looked at the behavior of our students on social media? They wear masks at school, but not away when they are with friends. There is no social distances at school or elsewhere. Many are behaving as if nothing has changed. It would be wildly reckless to return to any in-person if some elements in the community refuse to behave in a way contentious to public health and safety.
Lily Colbert states, some elementary schools in Newport-Mesa have higher COVID rates than some secondary schools in the district. Why are you closing all secondary schools? Why is the board not looking at just closing the specific elementary or secondary schools that have higher rate issues? Another option that should be discussed is to just close high schools and keep middle schools open. There are other options to consider than just flat out close all secondary schools for 3 weeks. What happened to our plan of closing a school that has a 5% COVID rate? Newport-Mesa schools aren't even close to that rate. What magically happens on January 25th that will make it okay to go back to school? If you ask a healthcare professional, most will say we'll be in the same situation January 25th that we are now. If you close school now for 3 weeks, you won't open for 3 months. It seems like the district isn't looking at all the various options that could keep more kids in hybrid and in person. Why aren't the schools using outside classrooms or having classes outside? New York City closed down certain streets so schools could hold classes outside. I see no creative problem solving by our district.
My comment comes from Lori Hardiman. As a primary care physician practicing in the community, I agree with return to distance learning until the end of January. Hospitals are full and it is not worth the risk to teachers, parents, or to children given that a vaccine is soon to be more widely available. I have children attending both Ensign and Newport Harbor.
My comment is from OFA. The decision for temporarily shift to distance learning after the break is a must. With the surge, it is better to be safe and take the necessary steps to minimize exposure. However, as a mother of a high schooler and elementary students, I am surprised that this decision excludes elementary schools, where the number of cases are rising too. Those numbers don't take into consideration people who are positive, but either not disclosing it or they're simply asymptomatic and don't know it yet. We all know that kids can be carriers and pass the virus at home to other members of their household. It is important and imperative to make the same decision of temp shifting to distance learning to all schools, including elementary and secondary. Thank you.
My comment is from Lori Shepard. In your letter to staff, you admit that the cases are increasing at a tremendous rate. You speak that there will be a surge after the holidays. So your decision is to close everywhere except elementary school. This decision is mind-boggling. How can you not see that it is more important for the children to stay out of a pandemic than to risk the lives of teachers, staff, and classmates by sending them during that important 2-week period after the holidays when we know families will be mixing? This dashboard is a joke, providing false numbers to families that are believing it. Does everyone understand that the dashboard relies 100% on self-reporting? Testing centers do not notify your workplace or your school. The dashboard isn't updated by the state, it's updated when people are good enough to self-report. That is not an accurate count. It is this board's chance to do the responsible thing and do distance learning for the 2 weeks after Christmas break. We have done all the legwork to make this transition easy and successful. The students have all the tools they need. It's only 2 weeks. To not do this for our children and the staff at the elementary schools would be an irresponsible travesty. You are putting your staff members and students at a tremendous risk. You would be contributing to the spread of this disease and slowing an end to this pandemic.
And that is the end of the 20-minute time period.
Okay, thank you, Rosie, and thank you for all the comments. And I will again state that we have the entire list of comments and we read every one of them. Superintendent Lee-Sung, would you like to take over?
Yes, thank you, President Yelsey. I'm going to take a moment to bring my presentation up to the screen. Okay, you can all see that? All right. So good evening, everybody. President Yelsey, members of the board. I'm here today with a very difficult recommendation. President Yelsey, you said it at the beginning of the meeting. We'd rather not be here having to discuss something like this. We worked very hard to build a hybrid program where our kids can safely attend school in person. We really worked hard to make that happen, and I do appreciate everybody's comments. I do appreciate hearing the comments of how much people want to be in school, in person, as I said before, where they belong. Unfortunately, we have some circumstances that are outside of our control that's affecting our district, and has caused us to very seriously look at the time period immediately after our winter break. So tonight's presentation is to provide some information and background and some data, but more importantly than just the data, but also some of the stories and the impact that's happening in our district. Really, over the last week and a half has been quite an increase and exponential impact to our district. So we're going to try to share that with you with enough numbers and with enough details so that you can make the best decision for our district. So tonight's recommended action is this, that we're recommending that secondary schools, including our secondary SDC classes, that will shift to distance learning, temporarily shift to distance learning, beginning Monday, January 4th, 2021, through Friday, January 22nd, 2020. And we would resume back into our hybrid instruction on Monday, January 25th. So this does not, of course, affect our cloud campus and our early college high school. And I wanted to make this very clear that this recommended action is just for our secondary schools, grades 7 through 12, and it does not include our elementary schools who will remain in hybrid. The other part of the recommended action is that we have all in-person student activities temporarily suspended during the same period of time, starting with winter break on Saturday and also through Friday, January 22nd. And I'll explain a little bit more on each one of these recommended items on a later slide. I wanted to bring this particular slide back. This was something that was taken from a presentation during the summertime. And if you recall, back at that time, we made a decision in June to give parents a choice to have their student attend a virtual learning school, which we're now calling Cloud Campus. And we have about almost 2,000 students who have taken advantage of that opportunity. The other option was to be part of this 3-level adaptable plan. So if you remember this slide, I stated at that time that depending on the circumstances, we would have to shift between level 2, level 3, or if things got much better, we could go back to level 1, which is kind of our normal instruction. So here we are, unfortunately, that we've been in level 2, and now we're considering for secondary to temporarily move to distance learning. But this is the structure that we had built back at that time. Now, this next slide covers the factors and the considerations leading to this recommendation. And we have looked at guiding principles throughout this crisis. And there's about 7 or 8 different guiding principles, and they're all great. I think everybody can support each one. What has been so difficult in this crisis is the fact that when you address one area, most of the time you're impacting another area. So I wanted to point out that in this particular recommendation, we are looking at both safety and instruction, And knowing the board's interest, hearing from our community, hearing from our staff, hearing from everybody kind of weighs into this particular decision. But one of the things that I want to point out is that it's not just one thing. This is one of those decisions that is based on the totality of a lot of factors and considerations, which makes this so hard. And I heard a lot of public comments, which are all great, and focusing on one particular thing. But when we're making this recommendation, we're having to look at the totality of this. And some of those include our state, regional, county, and city, our local data, some district data, and the overall impact that that's having on our district. We also are making this from a district-wide perspective, where we have to support all 33 of our district schools and the operations to support them. We're also looking at some patterns and some projections for that holiday period, or for the weeks after the holiday period. And I think another key question is, why make the decision now? Why make the decision now? So I will talk about that in a little bit. So starting with our current status, and as you all know, we've seen some significant increases in COVID at all the levels, whether it be national, state, regional, county, city, or the district. And what's causing that? Well, you know, we're in the winter season now. There's colder weather. There's more indoor activity than there was. Holiday travel, we're just coming off of the Thanksgiving week, and we're feeling the effects of that. Social gatherings, as well as the fact that, you know, a lot of people, it's tough. We've been at this for a long time. People get tired. And then there's some folks who just don't want to comply. And we're seeing also the exponential effect of the virus. So looking at our state, And I took this off of the state website. This is our state right now. As you can see, it's almost entirely purple, which is at the highest level. And you can see some of those statewide metrics there that I circled in red, okay? So we now look at our Southern California region. This is our region, and this is part of the regional stay-at-home order that the state enacted, okay? When we click on that Southern California region, this little box comes up, which talks about the availability of staffable ICU beds, And the trigger for the stay-at-home order is a threshold of less than 15%. If we drop below 15%, then the stay-at-home order is enacted. And that occurred back on December 6th. And that percentage has been going down. And this was just updated earlier today, where our region is now at 0% ICU bed availability. This is a chart that shows the county tiers. And so we have been talking a lot about purple and red, and there was a time where we were between orange and red, and sometimes in yellow in our particular area. But we're now back, of course, above the widespread purple tier. So let me give you some numbers now. Looking at Orange County and the positivity rate, just last week, we were at 30.3. A month ago, on November 10th, we were at 5.6. And just to kind of give you some comparison, when we opened our elementary schools, we were at 4.3. When we opened our secondary schools, which was that week of November 10th, which was actually November 9th, it was 5.6. Okay, keep in mind the purple tier is greater than 7. So currently in Orange County, for positive cases per 100,000, we're at 42, slightly over 42. When we look at the positivity rates in the county, last week we were at 10.6, 3.3 a month ago, and elementary when we opened was 3.1 and secondary 3.3. Where are we now? 13.2. Drilling in a little bit closer to our local community, the city of Costa Mesa in positive cases. Last week was 22. A month ago, 6.4. Elementary, when we opened, 1.73. Secondary, 6.41. And as of this week, city of Costa Mesa is at 48.84. How about positivity rate in the city of Costa Mesa? 7.7 last week, 3.5 a month ago, 1.2 when we opened elementaries, 3.5 when we opened secondary, and currently it's now at 10.9. Next is the city of Newport Beach, positive cases. 9 last week, 4.59 a month ago. You see elementary when we opened was at 0.82 and secondary was 4.59 back in November 10th. And currently Newport Beach positive cases is at 20.97. Okay, how about positivity rate? Last week was 4.0, 3.2 a month ago, elementary 0.8 when it opened, and 3.2 for secondary. And currently the positivity rate in Newport Beach is 6.8. So as you can see, in all of these examples here, whether it be our local cities or our county or our state, the numbers are dramatically rising. So now I want to drill down even further into our district. So as you can see, the cases here, oh, by the way, I'm going to turn this over to Dr. Jocham. So Dr. Jocham, I won't steal your thunder here. So
thank you, Superintendent Lee Sung, President Yelsey, Vice President Bardo, board, and Zoom attendees. So as the superintendent shared, a lot of the county and local data, but what really speaks to us is the number of positive cases we have had just within our district. And this is taken from our dashboard. And if you look, just over a month ago, we had only 29 positive cases. And as of today, we are at 141 positive cases. And what that means is there isn't a, people fall on and off the list. So this is in any given day, how many folks we have out for being COVID positive. And one of the things I really want to point out is what goes into the work when you have a positive case. And I'll kind of go through it on both the staff side and the student side, just so that people have an understanding of the amount of work it takes to process this information. So if we hear from a staff member that they are COVID positive and they have had a positive test result, the information starts in human resources, because there's different provisions for leave and that kind of thing, and we need to notify supervisors or get substitutes and all of those things. Then typically the case gets transferred over to our Director of Healthcare Services, Mary Groska, and Mary has been tasked with calling folks who have tested positive to get more information from them. And a lot of it is the date they were positive, when they were tested, when were they last at work, who were they around when they were at work, do they have kids in our district, when were their kids around. And these initial phone calls can take quite a bit of time, and people often are anxious and need a little reassurance about their positive status. And then often we have to loop back to them, that they don't always remember their entire day or their 2 days before they tested positive. And it requires our staff to go back in and ask them additional questions. And so between Mary and the hard work of Kristen Clark, Megan Brown, and Shoshana Nakano, along with Assistant Superintendent Leona Olson, this has taken hours and hours and hours of work on the staff side. It's nights, it's weekends, so that we can ensure that we're not having anyone who tests positive come onto our school sites or any of our school campuses, and that they get the appropriate direction from the district that allows them to remain home in isolation until they are well. On the student side, those cases typically start at the school site and through the administrator or the school nurse. And the school nurse and the health assistants are contacting families who have reported that they have a student who is COVID positive. And there is, again, this amount of work of backtracking for at least 48 hours when the student was first had symptoms of when they were infectious, and finding out who they were around that was closer than 6 feet for more 15 minutes of cumulative to determine close contacts. So again, with that, then it's notifying, especially at the secondary level, you're notifying every single teacher, and you're trying to, if they have been in contact with those students, and you're trying to walk students or families through these students' days to see who they actually came in contact with. And with secondary, because they also have a lunch period, there's additional folks we need to rule in or rule out as close contacts. And then we'll talk a little bit later about the ongoing stuff when you have close contacts, because that's another additional set of conversations with folks if they have been identified as a close contact. If they're an employee, there's another step through human resources, and there's also really walking people through what it means to be a close contact. They then have to stay home and quarantine. And then if they turn positive, we go down a different road. So it's just, and again, our nurses and all of these people are working nights and weekends. Several of our administrators have taken on calling their staff on nights and weekends just to reassure people and to try and get the most timely and accurate information, so that we don't have either staff or students at school if they're not supposed to be there. So it's just to try and give you an understanding of, this was busy and hard when we had 29. Now that we have 141, it's really becoming almost paralyzing to the work that we need to do, because there is just, and then just each positive case, or each case, each call we get in general, whether it's a positive case or a close contact case, or just somebody who's reporting symptoms, they're never a one call and done. They usually require multiple check-ins over multiple days in order to really get the most accurate data. So, and then there's also a whole reporting factor with the Orange County Healthcare Agency that we have to consider as part of this work as well. And they have been overwhelmed and really limited in what the doctors there are able to do to support districts. So we know that we are probably actually having some under-reporting of cases because the county is not getting them, and then we're not getting them from parents. So this is the most accurate data that we have to date, and then we can move on with some of the other information. I just wanted to share that. And then I can speak to this slide as well. I'm sure all of you have seen this, and this is our dashboard, which gets updated. We try and do it every day around the same time, but sometimes it depends on when we get information in. And there is some lag time, and often our staff hears about a case because one of their colleagues has shared with them that they're COVID positive, and they look and it isn't on the dashboard. And some of that just is the nature of our work, that there is a certain amount of lag time into getting things up and running. But we believe the data is fairly accurate. And even though it's a proportion of the school population, it doesn't tell the entire story. The other thing, as our cases have continued to climb, we're looking at changing proportion to percentage. I think that will be easier for the public to read and understand. So we'll be making that change when we come back in January. And also, just for the trustees and for the public, over the winter break, there may be, over the holidays, we may not update it every day during the holidays, kind of depending on the staff we have and if we have cases and that kind of thing. But the cases that are currently on automatically will come off after 14 days. So you may see a dip because those cases are coming off. And then this really goes beyond our students who are positive. And what this tells us is that starting at the end of October through November, we had 71 students who tested positive. And in December, as of yesterday, we had 128. And the reason there's a plus on there is that we know that number is still going to go up, even though we only have a couple more days left of one more day before winter break. And even though we may not even have kids in school, those numbers may still go up. The other thing that I spoke about was the close contact, and those are kids that need to be in quarantine. And in the October-November timeframe, there was 178 students that needed to quarantine, and the impact that really has on education and staffing and trying to provide support for those students. And then as of December 16, we were at 72 close contacts and climbing. And then one of the things I think is really interesting, and it really shows the tremendous work by our nurses and our health assistants, is that when parents report an absence for their student and it's any way related to COVID, either through the symptoms the parents are reporting or something else, our nurses and health assistants have been working to follow up with those families. So in October, there were 476 contacts by our nurses with families who had reported their students had some type of COVID-related symptom or illness. In November, it was up to 725. So this is during a 8-hour workday. Our nurses and our health assistants are contacting this many parents in a month to truly find out what's going on with their students and to give them some direction about when kids could return to school. And as of December 16th, we're at 590.
Okay, I'd like Leona Olson, our Assistant Superintendent of Human Resources, to now share a little bit about the impact that's going on with staff.
Great, thank you. Good evening, President Yelsey, Vice President Bartow, trustees, Superintendent Lee Sung, and guests. I'm very pleased to have the opportunity to talk to you about the impact on our staff because it is most concerning. You heard a little bit from Dr. Jocham on the process itself. So there's great concern for the staff that is managing this, as well as our staff on our school sites. And then, of course, covering the classes and positions in order to provide services for our students. So where I will start is this slide that you have in front of you. The top line there shows you the growth of COVID positive cases for staff. This is only staff numbers. So while in October there were 4 cases, you can see how it grows very quickly at the end of November 28 and December 43, and it is now 44. So it continually grows, and those are big numbers for us. The other 2 lines that you'll see there is when the calls come into HR, as Dr. Jocham shared, they come into us usually as symptomatic or close contact, and we touch base with each and every one of those employees, and then we track them. And then if the case becomes positive, then we work with Mary Groska and her team. So the way to read it is, for example, in October, we had 12 symptomatic calls come in, 8 close contacts, which is 20. Of those 20, 4 either were positive or became positive once we were tracking them. So again, you can see the numbers just start to increase drastically. We end up with 120 calls, people that we are working with, 28 of those were positive. So some of the, and then again, you can see 170 to then 43 cases becoming positive. So as Dr. Jocham shared with you, the calls come in and we do the initial intake, we get the information, and then we do track them. So it is not a one and done. It is usually 3, 4, sometimes 5 calls. Talking with the folks and tracking them and making sure that they are getting what they need and that they also know that they are not to report to work or a school site. And the volume of this has actually, I need to share with you, paralyzed our department. So while at the beginning of the year, as we first entered into this environment that we're in, we improved our processes, we moved hiring into digital platforms. However, given what we're doing right now, our staff is having great difficulty addressing other employee issues, having difficulty continuing the hiring process, though we do it. That's why the hours are there. We've hired some retirees to come in and assist us with the calls because we can get 15, 16 calls in one day. So while that may not have a direct impact on students, it certainly has a direct impact on the organization and the operations of the organization, which we have to be concerned about. What I will also share with you is where the greatest impact is in terms of departments and categories without giving you any real, I can't give you specific detail because of confidentiality, and we want to make sure that we are following that. But over November and December, our greatest areas is our support staff. And we know that our support staff is the fabric. They are behind the scenes. They're the ones who keep the operations of the district going. And they are also the ones that provide, many of them provide direct services. So our instructional aides have been significantly impacted. Either being symptomatic or a close contact out of work, inside work. And then our next largest group impacted are teachers. And our teachers being in these categories and therefore not being able to provide services to students. I know that you're aware that nutrition services had and we have had to change the way that we are delivering services for our students because of the great impact that it has had on that department. Our custodials, actually in the last month, in December, there has been an impact. There was a public comment about a particular site that where the custodial staff has decreased. So we've had to make some shifts there in order to maintain the enhanced cleaning that we are doing in order to keep students in classes. And then I don't want to leave out, this is also impacted, and we've had supervisors and managers that are in these numbers that you are seeing. So the people who are trying to lead and manage and coordinate our efforts are also many times having to stay home, quarantine, and take care of themselves so that they can get better. So all of these things are very concerning. I do want to speak to how we are addressing the vacancies or the when people are out, but I think that the numbers themselves is really, really powerful to look at. So I'll start with certificated and substitute coverage. Knowing that this was going to, expecting that this was going to be a difficult year, right in the end of July, beginning of August, we changed some of our recruitments for substitutes. We probably have done 3 times more recruitments than what we usually do. In the past, we've done a recruitment every month, and we multiplied that. We also started doing some targeted training because we know that substitutes are much more comfortable going to the school site if they have some type of training. So we've trained them on safety protocols and supported them in that way. We've reached out to student teachers. In the past, they may have just come to us. Now we're actively recruiting them as part of our substitute pool and continuing to build the pool. And then we also run specific pools for special areas such as special education. One of the other things that we have done is at the beginning of the year, we did, professional development and release time, just to lower the numbers right from the beginning of the year. Working with the ed division, we said we need to suspend the professional development that we do through release time. To give you an example, in the past, it's not uncommon for us to have about 550 substitutes in 1 week, and about half of those being professional development. So we have cut that out in order to ensure that we have more substitutes available for the day-to-day and the issues with people being out. We also did a little bit of a strategic scheduling when they're looking at how are we using our intervention hourly support teachers and having them do AM, PM work. So these folks work about a half day. So having at the school sites an AM and a PM, we hired additional hourly support teachers so that all school sites had the AM, PM configuration, so that when they were not doing their hourly support, their primary position, they have the opportunity, and we ask them to substitute when we need them, and we're using them heavily right now. We also hired temporary teachers on contracts. We have a couple that are floaters. We also, for folks who are out on specific leaves, for which we're seeing many more leaves, for instead of going with a long-term sub, we're actually contracting with those folks. And then when somebody comes back after 3 weeks, then we put that person elsewhere. So we're utilizing that a little bit differently to try to provide the coverage that we can do. At the high school level, we still do period coverage. So I think that was mentioned in one of the public comments as well, is that if there is a teacher out, then another teacher, if they have a preparation period, would go into that class. We are now using our teachers on special assignment, our TOSAs, to cover classes, and we have not done that in the past. That is a new practice. And we've, administrators now are going into classes more than before. They've always done some coverage, but now it is more than before. And in fact, they tell us sometimes they're very concerned about, am I going to be in the classroom all day today, or am I going to be monitoring the rest of the campus? Some of the things that we're not able to do that we've been able to do in the past that compounds our issue is we've been able to combine classes in order to provide coverage. But with the cohorts and separate cohorts, then we don't do that. And so there's an impact there. The other impact that we've had is that we usually have about 6 to 9 people on leaves, just general leaves, baby bonding, pregnancy, and that's been the pattern actually for many, many years. And we still have those. But then on top of it, we have right now currently about 16 other additional leaves that we usually don't have, that we've had to hire for. So whenever we're hiring more people, oftentimes that depletes part of our substitute pool because we pull from those people and they become our teachers on contract. So we have definitely tried to reach out and provide as much coverage as we can. And have as many people in the pool as we can. We are finding that now the substitutes are now turning down jobs, not being comfortable going into the classroom. And so that is a little bit of a challenge for us as well. So the coverage that we are not able to provide, that's not on this slide, but I'll talk to, is so with our classified and our support staff, we have very limited substitute pools. We have some, but many of the areas that I shared with you are hard to fill classifications. So we don't get a lot of applicants. And so again, a compounding effect, while the department recruits, has ongoing recruitments, it is hard to bring them in and to hire because the pool just isn't there. And we're finding that throughout the county. So we do have some significant challenges. We're very, very concerned that given another surge, that we will not be able to cover classes as we want to. Our highest after the Thanksgiving break is we had 24 unfilled positions in one day. And we had to scramble to try to figure out how to cover those classes. It'd be extremely, extremely difficult. So concerned that we aren't able to cover classes, there's an impact there, and then also concern for our staff who is trying to monitor and stay on top of it and keep everybody safe.
All right. Thank you, Leona. Really appreciate that. I appreciate the work that all of you are doing. Same thing with Sarah Jocham. You know, I just want to add just a little bit more before I move to the next section here. You know, I'm really proud of the work that our staff is doing under these circumstances. It's been a long crisis, and these last couple weeks have probably been the most intense of all. And, you know, just like we hear from our healthcare workers, the fact that they are overwhelmed, I can say that that's what's happening with some of our staff in some of the areas. And I really appreciate what they do, and for Leona to give a glimpse of their world, and Sarah to give a little glimpse of her world with everybody. But it's really been the volume and the intensity that has really kicked up over these last few days and last week and a half. Let me move to the next section here. So this is why we're here. We are very concerned about what happens after the holidays. Having a workforce to teach our kids, to supervise our kids, to provide all the services is really a serious concern for us. And so what's predicted to happen after the holidays? And I mentioned some of these things earlier. We're obviously in the winter season, more indoor activity, holiday travel, social gatherings, etc. Something that's new on this list is the holiday shopping, and the preparing for these holiday gatherings is occurring right now and will continue to occur through the holiday period. And then again, the exponential effect of the spread. I had been saying these in this next phrase in my own words, but I thought I'd look to see what Dr. Fauci is saying about this time period. And I found this quote from him. It's just recent, just back on December 1st, but He stated you're going to start seeing the curve that has gone to flatten out, only to go back up again. And then we're also going to likely see a surge upon a surge. So what's concerning about this particular holiday season coming up is we're already at very high levels now, and we are entering into the next holiday season. When we entered Thanksgiving, our numbers were obviously much lower going into that holiday season, but now we're going into this at a much higher level and higher levels than ever before. So now, this is what we are proposing and why tonight. So the first question is, why move or shift secondary to distance learning? And that's simply to eliminate the student, staff, and student-student contact at our largest and most populated schools that serve our older students. And we know that maintaining the cohorts of students at our secondary schools and preventing the mixing of these cohorts is more difficult at our secondary schools because they're shifting from class to class. Now, we've taken some measures to minimize that, but there's still that movement from class to class. We also know that there's more independence with our secondary students so that they can learn digitally. We all know that's not ideal, but there's greater independence for our secondary students to do that, okay? We also have the ability to redistribute or repurpose our staff to our elementary schools. And that's really important, that when we are short of staff, whether it be a custodian or a campus security or an instructional aide or somebody that we need, or a substitute teacher, that we would be able to redistribute them to our elementary sites. And the last one is that I just want to make sure this is clear to everybody, is that when our schools move to a temporary shift to distance learning, because we are already open, we are eligible to reopen. We don't have to wait for our county to move back into the red tier for so many days or weeks. We can open at any time. And we put that specifically in our action item tonight, that we would return to our hybrid learning on January 25th. So the next question is, why temporarily suspend our in-person activities? Well, it's quite simple. It's the same thing. We want to eliminate the student-staff, student-student contact, not only during our school day, but also at any other time. So that would include our activities outside. It would seem very misaligned in terms of if we're saying, no, we can't have you come to school here, but then we turn right around and students are participating in their activities there on campus, okay? We want to reduce the number of contacts during this heightened period, which we know that's very likely to be right after the holidays. But I want to also emphasize that doesn't prohibit these groups to continue to do activities remotely. So we do want them to connect, stay connected, but it just has to be remote and not in person. So here's the other question. Why not shift elementary to distance learning? So the first point is very important. We've heard this from many, many parents. We've heard this from teachers. We've heard this from a lot of folks that, you know, in-person instruction for our youngest learners is really important. And we want to recognize that. So we're recognizing that the impact to that is much greater on younger students if we had shifted to distance learning. We also know that our elementary sites have fewer students on campus, and we can maintain those stable, consistent cohorts in each classroom, okay? The next thing is that, the point I made on the secondary slide, is that we can shift. We can shift the staff that might have gone to secondary or that they're assigned to secondary. We can shift them to elementary if, in fact, we have that workforce crisis and are short of workers. And finally, I do want to say that we're going to continue to monitor our COVID-19 cases and staffing availability at our elementary schools. And if we have to make an adjustment, we will. So we're going to continue to look and monitor our elementary schools during this holiday period. But at least we know we will have additional staff that we can repurpose if necessary. So the other question is, why make this decision now for this particular period? So as we know, there very likely going to be another surge of positive cases immediately following the holiday season. We know that there has been a pattern, a consistent pattern of increased cases. Every time there's a holiday period, whether it's a 3-day weekend or the Thanksgiving week, and when there's increased travel and gatherings that are occurring. And we also know that our ICU capacity is now depleted in our Southern California region. And of course, our data in our county, our cities, our schools are already at the highest levels. Here are some other factors. So one thing that we talked about long and hard was, do we wait? Do we wait until the holiday time? Do we wait until January 4th to make this decision? And we believe that providing advance notice to our parents and employees is important, and that we need to make this decision and get a notice out to them if in fact we move to distance learning during this period sooner than later. Okay, everybody needs time to prepare, whether you're a student or a parent or a teacher. We also have to make shifts in our instruction, shifts in transportation and food service, and many of our key operations. We also anticipate that there's going to be increased absences, quarantine, of people that just get sick, or people that might come in close contact with somebody over the holiday period. So there's definitely going to be a high likelihood that there's going to be additional cases, illness, close contact, et cetera, over the holiday period that may not become known to us until January 4th. And that, of course, if we find out at that late date and we have all of our schools open, could create a workforce crisis. So the final consideration that I want to end with is that, as we know, we all have to do our part. We need to do our part to slow the spread, okay, adhere to those protocols that we all know that I did not want to repeat again. We all know what they are, but particularly right now in this holiday period, to minimize or eliminate travel. And there's actual guidance on holiday gatherings of how we can get together, but to do so safely. And we also need to do this to keep our schools open. We want to bring our students back. We want those numbers to get down where we can bring them back. And finally, to me, this is so critical that we need to do this to support our healthcare workers right now. We need to do this to support our healthcare system so that the people who need the critical medical attention can get it. To me, that is one of the most scariest numbers that I've shared in this entire presentation, is the fact that our capacity for ICU beds is now depleted. So please, let's all do our part, and I will leave you with that, with our recommended action. President Yelsey, that concludes my presentation.
Thank you, Mr. Superintendent Lee-Sung. Do we have any questions from the board? Trustee Barto.
Hi there. I wanted to go through a few of the questions on my list. So I think some things that we haven't, I appreciate all the numbers and how overwhelmed staff is, and what a crazy time this is, and how we need to support our community. And I think that's a noble goal. But my concern is providing how we continue to provide a high quality education through distance learning, because that is one of our missions, right? It's to provide a high quality education, and distance learning, it's better, but it's still, well, it still does not compare to in-person learning. So I would like to know how we plan to support that at the beginning of a semester for our students at the secondary level. And And if we have a plan to bring back those who, again, don't have access to Wi-Fi, who have sick family members at home, who for mental health reasons need to be on campus, because I would hate to make this very important move for safety, but then deprive our students of their mental wellness as well. And I know we're all stressed, but I think that's a real, I don't think it needs to be either or. I think we need to say, okay, if we can't be here, how do we support our students and how do we continue to provide that high quality education? What's the plan for that? Even if we don't have that now, what are we working towards?
So as you know, we've worked really hard to improve our distance learning program, particularly from when we first started back in March and April and last school year. I was, pleased that when we started this school year in distance learning, there was a notable improvement. We all know that distance learning has its shortcomings, which is why we are all pushing for in-person instruction. I do know, and listening to some of the comments, that in some cases that's falling short of what it should be. And I think it's important for any parent or student who's experiencing that type of experience, is it's okay to say something. First to the teacher, in all fairness, first to the teacher, to say, you know what, these are some of my needs. These are some of the things that I would prefer to see. And then, parents can get involved certainly in conversations with the principal or the counselor. But we certainly want to provide the best standard that we can. We've come a long ways from when we first started, but it certainly has its shortcomings that we need to address. So, the good news is that we've been through this before. We've been through this before. And I do know that our secondary students, it's a little more conducive for that to occur. That's a good thing. I don't know if you remember at the time when we were actually about to move into in person, we had quite a few people saying, hey, distance learning is actually working for me. So, and sometimes it comes down to a personal preference that some students, distance learning is fine. Others really hate it, So we're going to do our best, but if we're falling short, by all means, please talk to the principal, talk to the teacher directly.
And I think that that's important to talk about the difference. I think that there are some teachers who enjoy being on distance a little bit more. Obviously, teachers who chose not to go to the cloud were hopeful that they would be teaching in person. And that definitely affects the ability, what happens in that distance learning classroom. But I'm really more concerned too about like the mental health part of that. And for some students, the Zoom can be so incredibly isolating. And as we know, the holidays are always a rough time for mental health issues as well. This just compounds that coming back. I don't want to stack COVID lives over, mental health lives, but I think we need to look at that and what are our strategies for dealing with that and how are we going to support people? Do we have an extra helpline? What do we have in place for people who are feeling very isolated and who, their mental health issues are compounded with the fatigue, with the holidays and the being on Zoom. I think that's probably the biggest thing for me why I'm not like, all right, let's go full steam ahead.
Mm-hmm. Right. Well, without going into, that could be a whole nother presentation, as you know. And, again, I'm very proud of this district in terms of the resources we put into mental health support. We've trained all of our teachers this year. They knew this was going to be a big topic this year. And we went through all the training with that. But even though we're moving to distance learning, all of these support resources are still there, and if a student has to be seen in person, they will work that out. They will work that out to make sure that the kid and the family gets the support that they need.
Thank you. And I would just encourage that as much as possible, we amp that up during this time, if this is something that we end up deciding to do. Some other concerns that I've heard from the community, some underlying concerns are that we won't go back. What happens that's different on January 25th, those sorts of things. I think, we kind of went through this when we were looking at what's different about December. And I think to me, that's the holiday surge and the 3 weeks and those sorts of things. But and obviously we can't say, oh yeah, COVID will be fine let's go back on the 25th. But I just think it's important for families to know that we're committed to this being a short thing and not a long-term plan. It's not what we're doing for the rest of the semester. It's truly a couple of weeks is what we are anticipating.
Right. And Trustee Barto, thank you for pointing that out. I just want to emphasize the way that I wrote this recommendation. I put temporary throughout. I put a specific date to come back. I think we're all committed to return to hybrid learning on that date. Certainly, we don't all have a crystal ball, but that is our commitment.
And then 2 more questions. I think it's also important to discuss with the public how we have discussed that if, you know, that surge doesn't happen, that we can consider opening early. It's not like we're definitely committed to this, and if we, you know, this is what we have to do.
Right.
I do see people taking more people than I have ever seen taking this seriously and quarantining in the last couple of weeks. So maybe that will be a saving grace for us all. And I just wanted, if that's something that happens, I want to know that we have that flexibility to go back in person. And what are we going to use as our benchmark? Do we have one? Like, what can we establish as kind of our internal benchmark? Maybe I don't think we have one yet, but what would that be? Or could we think about that and put that out there?
Yeah, I don't want to create an arbitrary benchmark here, off the top of my head. But first of all, that would be wonderful. I think we would all be thrilled, not just here in Newport-Mesa, but everywhere, to see our numbers go down. And if people can really take heed to all of these protocols and having some sacrifices over the holiday period, that would be wonderful news. We'd have to assess it from a lot of standpoints, not just the data, but what is the impact to our workforce? Okay, but you know what? I think that's what we're all working towards, is to get kids back as quickly as possible. And if something very incredible happens where we can bring people back earlier, we would reconvene and we would reassess that. Okay, but I can't just give a measure or two or whatever. That just wouldn't be fair to the complexity of making that kind of decision.
And then my last question is, as much as possible, can we maybe expand on how this isn't just our own decision, how we're looking at the data, but we also have input from public health officials and doctors, different institutions, that we're not taking on the role of the scientists and the epidemiologists and the doctors on our own and deciding that this is what we need, because I think that's really important too, because Dr. Leah is probably the most qualified in that department on the board to understand the data based on her background, but I think in general, like, we make recommendations based on data, and I think it's important to know that that data came from somewhere, not just our internal calculations.
Yeah. Again, thank you for pointing that out. That's why I try to bring up that one slide about what tends to happen, what the pattern has shown, what Dr. Fauci has been quoted as saying. Those are things that we didn't make up here in Newport-Mesa. Those are things that are out there.
I'll let the other trustees with their questions. Thank you.
Okay, thank you. Trustee Crane.
Yes, hi. Thank you for the presentation. That was very eye-opening, and I really appreciate the data, because that's that really affects the way I'm going to interpret all this. Now, I did have a question in regards to the high needs kids. Once they are switched to distance learning, are they also going to have an option, if they're at risk, to bring them back to on campus within a small pod where staff can actually help them out as far as their, let's say, resources, because then the campus has Wi-Fi, for example, where they are at home or in foster care, they may not have those amenities or the services necessary. That's one. And the other is, I do want to echo Trustee Barto's focus on mental health and making sure that we do have those services available, and not only available, but out there so that the community knows that the services are available, and a push, some sort of plan to reach out to students and families, especially those that are on the radar.
Yeah, let me start with that one. I know, hearing it now from two trustees, Dr. Jocham, Dr. DiAgostino, and that whole staff, they're hearing this loud and clear. And I know that we all know that the holidays are a tough time just in normal circumstances. So we will make sure that they hear that and make sure that the resources and opportunities for anybody to reach out, even during the holiday period, are communicated.
Dr. Jocham, can you provide some examples? Like, can you provide the channels of how this could happen?
Sure, I can give a couple of examples, and the team is actually listening on this board night. So if I get it wrong, I'm sure they will correct me. But we have the Care and Support line, which we instituted last March when we went into distance learning initially, and we have not closed that line yet. And it's not a hotline, but what we have is someone from our student services division checking that line and helping to deploy the resources that families need through a call back. Sometimes we have different coordinators. So if it's an issue regarding homelessness or that issue, we have Angela Allen Hess. If it's an issue about connectivity, Wi-Fi, we have Sarah Coley. And then with the mental health, social emotional needs, we have Kristen Henry, and they all work interchangeably, and they all are well versed in all of these areas. And Phil is an excellent supervisor of all of this work. We do also have our behavior specialists. We have our social workers at secondary that if we know that there's certain students that are at risk because of changes in moving to distance learning, our social workers can reach out and meet with those families, meet with those students. They are able to do Zoom sessions with students. Sometimes that's not, students don't want that because their parents could still be there. So we could look at other options that we may not have had in the spring when we really didn't bring anyone back on campus for any reason. So there could be opportunities for some one-to-one if we needed to in that respect. And we have done a lot of training with our site administrators and with both our special ed and our general education teachers to ensure that they know how to reach out and they know the resources are out there. But we would also put that push back out again. So especially at our secondary schools, they know how to access those resources during distance learning.
One more question. Are we expecting the teachers to be in their classroom during that time period?
Yes. We believe that's the best setting for our teachers to deliver the instruction. So that will be the expectation during this period.
Good answer.
Thank you, Trustee Crane. Trustee Anderson.
We've been on Zoom so much. It's like it doesn't like mute and unmute anymore. I thank you for this presentation. I am glad that we are moving forward with this. I think considering some of those numbers, it is really troubling. And I know there are vast impacts to district operations and to staffing, particularly of support staff. And in looking through some of those slides, it seems like some of the reasons why we're considering this, the items under the critical factors slide, and then the one is what is predicted to happen after the holidays, share a lot of qualifications for elementary schools as well. And I think one of the things I'm concerned about is a timeline of, if Costa Mesa 92627, which is half of the city, is currently at a 14% positivity rate, and things seem to be doubling every 2 weeks. Where that leaves us near Christmas time is a really high rate. And so I'm just wondering if we were to decide to at some point include elementary in that, are we planning on having a special board meeting to do that? Are we giving parents and teachers enough notice? As I said on Tuesday when we initially were talking about this in open session, we were, I was hearing 50-50 from people in my area, and things, it's now about 60-40, but there are just a lot of people who are saying to me, if the secondary schools are closed, why not elementary? I would like all of my kids to be at home. So I just am wondering what that process will look like if we need to pivot, and how much time will we be giving families and teachers to prepare for that?
So one of the things I did put in the slide, and so I'll emphasize that here, is that we are going to continue to monitor what's happening with our staffing, with the numbers at our elementary schools. And, I think we're always going to have to assess that. And I'll remind you, the guidance also allows us to close an individual school if we have a large number of multiple cases and multiple cohorts with that. So we will continue to monitor that. And if we do have to make an adjustment at an individual school or multiple schools, we will continue to do that. That is part of the guidance.
Okay. Yeah, because some of the schools in my area are averaging over 50 kids that are absent for the past 2 weeks. And so the numbers are not necessarily showing that on the dashboard, because sometimes they don't know that kids are positive until they come back and the student says, oh, I've been out for 2 weeks because I had COVID or my mom had COVID. And so I'm just concerned that the 5% is not necessarily indicative of what is actually being experienced at a school site. And then I was also wondering too, if I know nutrition services, we've had to make some adjustments with meals, and I'm wondering if there's any way to, over the break, or just to kind of brainstorm ways to get some of those functions back happening in the actual school site's cafeteria space. I know at some of the schools still have dusty but operational stoves that are there. Is there a way to have some of those resources rather than being at a central kitchen? Can we decentralize and make some of those happen again on our individual campuses? Has there been talk about possibly doing that?
I can't speak to that, Trustee Anderson. That's getting way too detailed in a very technical, complex operation with food services. So, if you pose that question to me again, I can certainly request that from our Director of Nutrition Services to get you that information.
Okay, that would be great. And then I was just wondering too, if we are, as with some of the shifting roles, if for this brief amount of time, if we're not closing the elementary schools, if some of the services that can be realigned are like some of the health assistants. I know a lot of them got more hours recently, which has been really helpful, but then also the school facilitators are still really split upon campuses, and some are still doing 3 campuses. And I'm just wondering if we can please allocate some of those to our schools who are really impacted by this right now.
Yeah, absolutely. We're always looking at where we need to put more resources or where we can borrow some resources. And, you gave some examples of that, which I can't speak to that because I hate to commit here in public and take something away from another site. So even though it might not appear to be impactful, those are the kinds of things we'd have to just be very careful about. Okay, and we know those school community facilitators are valuable, whether kids are in person or at home, they're still valuable. So anyways, but always we're going to look at reallocating if necessary.
Yeah, because we have a few schools who are splitting them. And so school facilitators, their main job is not information sharing, it's relationship building. So when we have a school that has 2 or 3 facilitators that are alternating days, it's really rough. So I would just like more attention on that. Thank you.
Thank you, Trustee Anderson. Trustee Ursula.
Great, thank you. Thank you for the very thoughtful and detailed presentation. I really appreciate all of the work that staff put into that, for sharing all of those critical variables that most of us have no idea the operations of a school district. And when you tell me 170 people are impacted out of an organization, that's very significant. So my comments and questions are in 3 primary areas. One is following up on Trustee Barto's point about mental health. I know that Dr. Jochum mentioned the helpline, and it was heavily publicized early on, but if there is a way we can consistently market that helpline and make sure that the Orange County resources are listed in it, Be Well OC, which I'm sure you've heard of Mind OC and Be Well OC. Be Well OC has really intensive resource lists that families could really use for mental health, for all different levels and variables, from suicide hotlines down to therapy. So it's very important that families are made aware of all those resources that are there. And so if we can have some mechanism to consistently remind families of the helpline, like we were getting back in April, May, I remember getting those, but I definitely haven't gotten any in a good 6 months, I would say. So that is a critical way to let them know that we already have this helpline and these resources. So that's one. 2 is piggybacking a little bit on Trustee Anderson's concern about elementary. I know that's not at all what's being discussed tonight, but because it's not being discussed tonight, I would like to hear what in the future week or so, what our plan is going to be for those impacted families. Because from my understanding at this point, people can't choose the cloud. The cloud is pretty full from my understanding, and maybe it's not. But so for those families that are already dropping off the radar since Thanksgiving, after the holiday break, they're likely to also be equally afraid to come back as they are right now. So what is the game plan, rather than an ad hoc deal that they'll make with their teacher, to make sure that there's a concrete plan that all those parents understand that they can have access to, kind of like a cohort C situation for elementary in reality, that there needs to be some substantial plan in place for those families. Because for, I see it all over the internet and Facebook, people saying, well, you could just choose the cloud. And I'm like, well, pretty sure the cloud is full. I don't think they can just choose. I'm in the cloud and I've heard it's full. So, so that detailed game plan for families that are not going to want to come back. They're just not, they're already not there. So that's a reality that we have to contend with. And the third item is just making sure for our zone, which is the most heavily impacted, as Trustee Anderson mentioned, 92627 is at 14%. And, we have 45% of our community that's Latino. And we know from data that COVID has been decimating the Latino community. It's nearly 50% of the cases, and they're just 35% of the population. So it's a situation that impacts our west side significantly. So I want to make sure with you, because Estancia is on the 4x4 model that was agreed to many months ago, so they're in a unique position. I just want to make sure that because they don't have a cohort C option, this 2 to 3 week period off is going to be very critical for them, because those students don't have a cohort C that they can choose. But I want to make sure they're going to be able to stay in their 4x4 model, right? It'll just be the distance version, but they'll be able to keep that, right? Okay.
Yeah, that's correct.
Thank you.
Thank you. Trustee Whiting.
Thank you. Thank you for the presentation, the data and the numbers. I really appreciate all that information, and it definitely, and it's a struggle out there definitely for our operations and for us to sustain. But I wanted to ask a question. So we are seeing, I have a couple questions, couple comments. So we are seeing this spike right now due to the Thanksgiving holiday, when kids were not in school and people were not in school working, and they congregated with others. So my concern is that obviously when they're not in school, that's when this kind of these spikes happen. So for us to extend the winter break by 3 weeks, having 5 weeks, you're just going to see kids are going to have this, COVID fatigue, I guess is what I think was in one of your slides where you said there's COVID fatigue happening and they're not going to adhere to these guidelines. And so that's my concern, that I'm not sure that shutdowns are really effective in this. I mean, right now, everything is shut down in the purple tier in our Southern California area, and we're still seeing a spread like we never had for the other reasons. And there's a lot of reasons behind it. But, and then another thing I wanted to ask, this is a big question, is we put into effect that 5%, if you get a 5% positivity rate at a school site, then they would shut down. If we have that in place right now, and looks like from this recommendation that we're not adhering to that 5%. And so I wonder why we're going back on our position that we put in place. And then if that's what we're planning on going back on that, how can a parent or a student trust that we're going to come back on the 25th of January? So I think there's a lot of miscommunication out there, and it's concerning.
Yeah, if I may.
Go ahead.
Yeah, comment on that. So the 5% positive case rate, just so everybody knows, that is straight out of the state guidance. And it says that a school shall close if it reaches that 5% threshold of positive cases, or multiple cohorts, multiple cases, multiple cohorts. The thought of us waiting to that 5% to close is absolutely frightening to me, because as we know, as we see, we're looking at right around 1%, 0.5%. You average it out as 0.7%, and look at what it has done to our organization. So I cannot imagine what that would be like over 5 times as many cases of contact tracing, of closing classrooms, of all the things that are impacting us in our current status, what that would be like if we were approaching that 5%. So that's exactly what the guidance says. So I know that people are questioning that, but we are not closing because of that. We're moving to distance learning really because of the totality of this. If we didn't have the workforce concerns, if we didn't look at a holiday surge coming up after the holiday, we wouldn't be having this conversation. But it's really a lot of the things that are playing into that. But I tell you, the 5% is a really scary thought, that we'd have to wait to that point to take action. And I think this recommendation is the appropriate thing to do under the totality of all the circumstances.
And a couple other questions that I'm hearing. There are some areas we saw that Newport Beach has a positivity rate of 6.8% right now. And then the situation in Costa Mesa is different at 20.9. It looks like, there's some local control issues, or it would be wise if we could offer that the school sites can determine what they want to do and give that ability to the principals to determine to open or close or move everyone to cohort C, because now they have that cohort C that they can go into distance learning really quickly. So question on that, local control.
So first of all, that would not be my recommendation. We have always functioned as one district. And when we provide an equitable education to everybody, it's really with that in mind. And keep in mind that when we provide services to students, it's on a district-wide basis, or services to individual schools, it's on a district-wide basis. And we also know that every school has been impacted by this, every school. And we also know that when we have a workforce shortage, it's not just for some schools and not others, it's again district-wide. So that's why I try to emphasize that the perspective that we look at is really with all of our schools. And, you know, there's many things about local control that I absolutely support and appreciate. But local control is with this school board in terms of a decision that you're making for the entire district. Local control isn't necessarily every school doing whatever they want or what they, their individual needs. We always have to look at it from a district-wide perspective as well.
And then one more question about mental health. I know that when the schools went back in person, particularly secondary, there was a lot of people were able to identify abuse and homelessness by having that person in the classroom. And my concern now with the state having very restrictive guidelines and a lot of people losing their jobs and during the holidays, that we're going to not be able to identify those. And we are seeing a spike in mental health issues because of isolation, not because of people concerned about getting COVID. So that, and I wanted to also understand how effective is this care and support line? Are people calling in? Because it's great that we have this, but I want to know, is it actually doing anything? And
yeah. So I don't know if Dr. Jocham would like to respond to that, but again, we'd love to, at some point, provide a very thorough mental health support and other student support presentation to you all. Okay, Dr. Jocham, you want to provide some additional information?
Sure, I'll start, and then I've also asked if Dr. D'Agostino can come in. He knows more about the data related to the care and support line and the data that the information that our mental health team has provided to teachers and school staff throughout the year, starting last spring when we were in distance learning. And definitely the care and support line has dwindled as we've been back in school. We have not seen it being used as much as we did in the spring, but we anticipate over winter break, and if we go into distance learning, that there will be a higher need. So let me have Dr. D'Agostino come on and give you any more information on that. And then also, Dr. D'Agostino, if you can share any training or information that we've given our staff when kids are in distance learning on how to look for mental health or what they're doing with that. Thank you.
Good evening, President Yelsey, members of the board. Can you hear me? Great. So thank you for the opportunity. Sorry, I'm just trying to adjust my screen here. Oh boy, that was horrible. Members of the board, thank you for having me tonight. We are continuing to be vigilant about the mental health and wellness of all the students and families in the district. We have given directions to our behavior specialists, our school psychologists, our social workers to continue to monitor mental health and wellness issues. We are staying in communication with our school principals. The care and support line is monitored over the break. It was monitored over the Thanksgiving recess and will be continue to be monitored over the winter recess as well. And that will include mental health and wellness, as well as all of the other elements of the care and support line. I don't have data handy, right now to provide to you, but I can tell you that there has been a drop off recently on the care and support line use, and I think that's because we've had such great responsiveness from school community facilitators and other site support personnel working with students and families since we've reconnected with students through the distance learning program. So to the extent that we need to continue to monitor that and provide additional responsiveness, we're prepared to do that. We will have staff available over the winter break at the district offices, except for those days that are federal holidays. And I did appreciate the comments that were said by some board members about highlighting the care and support line again. on the district website. So first thing tomorrow morning, I plan to meet with Ms. Franco or reach out to Ms. Franco and have a conversation with her about how we can highlight that even more. And then I will also be meeting with my two coordinators, Sarah Coley and Kristen Henry, to see what other resources and supports we have in play for us. As you know, there are a lot of mental health and wellness supports and resources that you've recently approved as well. I know we'll be talking about how we can highlight those. And so, I'm confident we will be there for our students and our families throughout this break and then beyond when we return from the winter recess and start the new year.
So I heard you say that since we've been reopened, you're able to reconnect, the community facilities have been able to reconnect with the people that need this kind of support. Is that correct?
Well, we've always used the school community facilitators in whatever phase of distance learning we've been in. So whether it's hybrid or whether it's complete distance learning or whether it's in person, we've been leveraging our support personnel, whether it's school community facilitators or social workers or psychologists or counselors, to do the work that needs to be done when we're aware of families that are struggling or in crisis.
Yeah, I think a presentation about how your plans are to reconnect with those would be appropriate. Just, it's very concerning for me at this point.
Sure.
Okay, Trustee Barto, did you have your hand up again?
Yes, I had just one more question. To the last point, I feel like it's the elephant in the room. We keep quoting Dr. Fauci in these presentations, and he specifically said that it's best to keep the schools open. So I know he's only, one person, he's not the arbiter of what happens, but I feel like if keeping the schools open is something that someone who's advising the country on how to act, I think that we need to take that as seriously as the surge. That's just, it's such a concern for the students, and I'm so concerned for our staff, and I want everyone to be safe. And I want those families who choose to keep their kids home because they're concerned to have access to an education too. But I mean, we have specific guidance that it's so harmful to people in the long term. And I think we need to take that as seriously. So any thoughts on that or things like that?
Yeah, I want to make sure I'm not connecting Dr. Fauci's quote that I put on there as that he's telling us to close our schools or shift to distance learning. My quote there was just to validate the fact that there's likely going to be a surge after the holidays. That's my only connection to Dr. Fauci on that, okay? The connection to our decision or recommendation to shift to distance learning is based on that, the surge and the potential impact to our district and our workforce, okay? So I don't wanna draw the line between Dr. Fauci and gosh, we need to go to distance learning. It's the potential of what's gonna happen with our workforce based on what we have been experiencing these last few days and a week and a half.
And I appreciate the need to take care of our workforce because obviously then we wouldn't have anyone to teach our kids, and I value all of their heroic efforts during this time. I think that that's something that we're not taking into account as much is the needs of students to have an in-person option for mental health, long-term, stability, all of those things. And that all of these facts are so compelling, and there's so many parts of it. I'm really just trying to take a fair view of everything. And that's something I think if we make this recommendation and we go ahead with it, we really need to make sure that we're supporting that other part of our commitment, which is to provide a good education. And to this point, I think it's been fine. It's been, when we're in distance, it's an emergency. We've provided an emergency level education, but I think that we need to do better than that.
Trustee Anderson, you had another question?
Yes, thank you. I was wondering if the teacher professional development, particularly around distance learning, was continuing. I know that is one of the things that at the elementary level was happening on Wednesdays. What does that currently look like for secondary? And is that ongoing? Are they still getting assistance? Are they still getting access? Because I know one of the places we've been trying to hire are more IT support folks. So where are we on that? So we can ensure that children are getting the best education when they go online.
Okay. So I'll share first, and then John Drake, if you want to add. But I recall I did share with the trustees that whole series of PD that our educational technology department had put out, and gave teachers options on various topics. And I can't remember the exact dates. I don't know if that's still going on right now or if that is completed and we're waiting for the next round. So maybe that's where Mr. Drake can help me out with any additional details.
Yeah, so I know Janeth Mishny, our Director of Education Technology, has, like you said, has kind of a library of resources for teachers around distance learning that they can access, as well as principals have been reaching out to her really since the beginning of the hybrid, so that the support for using technology to support kids at home is still a focus during that time. So principals are accessing her. She has been going out with her team to sites on Wednesdays, and that continues to be available. I will have to get information to you of any kind of district-wide PDs that are available to teachers. Most of those are happening after school, but the upcoming ones I don't have off the top of my head, but I will get that information to you as soon as I touch base with Dr. Mishny.
Thank you. Yeah, I was just thinking over Christmas, but if they're like YouTube videos or if they're set up in a way that if teachers want more support, they can, access those. I think that would be really helpful. And then it was kind of interesting, Mr. Lee-Sung, when you were sharing about, 5% is scary. And I would agree that 5% is scary. And so I have 3 schools in my zone that have over 50 kids that are out, and nearly all of those are COVID related. That's nearing 20% of their population. So if we're concerned about 5% is shocking, we never want to get there. Again, I'm really concerned about some of the elementary schools and what we're doing proactively. I really want us to be proactive and not necessarily have to do a January 4th at 9 a.m. There's no kids here. There are no, I'm concerned that we're being proactive. And I think particularly because also what you were just saying about it's district wide, it's about our whole workforce, which to me encompasses elementary as well. So I want to make sure that we have contingency plans in place for some of those schools if they are at 5% when they come back.
Verify the 5% are positive. It's positive cases.
Yeah, I know.
Not close contacts or kids absent or kids who might have symptoms. It's positive.
Right. But if 20% are out and they're all COVID related, we could probably.
That's not necessarily positive.
Right. But it could get that way. So I just want to make sure that we have plans in place for January 4th, if we're not closing the schools right now, for elementary. Do we have plans in place for January 4th? If we have multiple schools that are at 5%.
Trustee Anderson, I don't have any verification that we have any school even close to 5%. So when you talk about a contingency plan on January 4th, I'm not sure what you're asking for. Contingency plan for what? Shutting a school down or having enough of staff to?
Yeah, both of those. Yeah, I mean, if a student comes to one school on the 4th and there are multiple kids that are maybe either there are calls that have come in over Christmas break. I just want to know if we have plans in place for our schools. If we have multiple schools that are over 5% coming back January 4th.
Well, there's going to be many of us working over the holidays. We'll be monitoring this throughout, and we certainly will be prepared. I know that HR typically will do this, that they'll make sure after any holiday period that we capture as many subs as we can before other districts, and hopefully they're not listening, that we will have as many of them signed up, ready to go. We did that after Thanksgiving, and I know we're prepared to do that again.
Oh, we did. Oh, that's great. I didn't know that. That's great. I'm glad. Thank you for
Yeah,
being.
we actually, yeah, don't tell. We actually did it before we came back to any of the hybrids. So Megan Brown, our administrative director, personnel, certificated personnel, secures subs, and she actually has them report here at the district office. And then we deploy from there so that we're ready to go. We don't have to do those last minute calls. And the plan would be the same for the 4th.
Thank you. And then I just have one last thing. I'm wondering, since we do have more people that are possibly at home, staff that are, I don't know what it would necessarily look like. Is there any way that we can have the Care and Support line be a live person? One of my concerns is if we have people who are calling in, particularly for mental health, that if the current setup is to leave a message, I just want to make sure that we are supporting our students and our school communities as much as possible. So if there's something that goes out tomorrow that highlights again the Care and Support line, is there any way we can have that be a live person, at least during work hours? And then I would love to, if we just spent money and got resourcing from the Care Solace people, I would love to know in the time that we've had them what some of those numbers are, if we've had people accessing that. And then I would love to know too, if we can, so if we're highlighting the Care and Support line, if we can highlight the Care Solace as a resource for people that are looking for offices, and then also Be Well OC, that as Dr. Ursula was saying, there are a ton of resources there. So if someone calls one line and they don't get through, they don't give up and they don't feel hopeless. Thank you.
Okay, we're taking a lot of notes.
Okay, Trustee Ursula.
Yes, thank you. Just to follow up on some of the comments around mental health and Be Well and the helpline. Dr. Agostino's mention of how the helpline calls have gone down of recent, and it might be because they've gotten the help they need at their site, and it also might be because we haven't heard about it as parents in months. And so we have parents are super occupied right now during this traumatic time. So again, the advertising of the line, but a lot of our families operate best. They don't use emails too much. They use texting. So I'm wondering if there's a way that we can get that helpline information out via text, text pushing to our families, especially our Spanish-speaking families that tend to rely on text and WhatsApp, the WhatsApp app instead of the emails. So if that would be possible to get those resources, because as Trustee Anderson mentioned, it needs to be live lines, because when people are in a mental health crisis, they tend to need a live line or else they won't call back, they won't come forward again. So to try to make sure that families get that information regularly, because it was pretty regular, I remember early on. So maybe every 2 weeks, maybe every month, what have you. All it is a simple email text push to just remind people that there is this resource so that they keep thinking about it would be very beneficial. Because my concern is when we keep talking about the trauma of isolation, there's also the trauma that our West Side families are more likely to experience, which is the trauma of having a family member go through it and be hospitalized and be unemployed because of, the disease burden. So there's all kinds of trauma across the district. And so the mental health is very important to all areas, not just, staying home is worse than going to school or vice versa. So I just want us to recognize that and be sure that we push these out very often to families. Thank you.
Trustee Metoyer.
Thank you. I want to thank all of our trustees for asking such wonderful questions. Then I don't have to, because you asked them all and then some. Thank you. I just want to say something to the parents and community. Please do your best to do everything you can over break to not break the safety rules, and to, if you are working with meeting with family, have it be your bubble family. This is not the 2-week period to finally get to go visit Aunt Mary from Las Vegas, who has been in major bowling tournaments for the last 5 years and has gone out of the country twice. This is the time to hunker down and hug the ones near and dear to you. Nobody wants hugs more than me, and my poor husband and my bubble people are just like, oh, I have to hug her again. But if we want to be open, everybody in Newport Beach and Costa Mesa have to do their part. They have to do we all have to do our parts. And then our people will be safe. And I'll even extend it to Orange County because our staff lives all over. So if we do our part, people will be able to be open. We want to be open. Teachers want to see children. Principals want schools open. The board wants your kids in school. But we can't run an operation with less than the staff needed to keep everybody going and everybody safe. When you're talking about that 5% number, 5% hit some of our departments because they're smaller departments and 3 people can take care of it. So we don't want to close, but there's a time when we have to do what we have to do. So that's my only comment other than what has already been asked. I defer to Mrs. Yelsey if you have any final comments before we take a vote. But thank you. And thank you all the people that came in to watch, because you can see how we have angst and we have questions. And this is our 3rd meeting on this in the last 2 days. So we really can do it. Thank you, everybody. Thank you, staff.
Thank you. And I agree with Trustee Metoyer. There were some really good questions here today. And I think we've all taken this really seriously. It's a difficult issue for all of us. I just have a question, comment, and then some other comments. But the question is, it's been talked about that we need to provide a good education. We're going back to distance learning, even just for several weeks. So we've all heard this personally. We've heard this throughout the whole time, talking about teacher accountability. And so, you know, we've all gotten comments. Teachers come on, they take attendance, and they're off Zoom. What are we going to do to assure that that doesn't happen?
Well, first of all, we have standards now in terms of what we expect in terms of distance learning. And Leona Olson can correct me if I'm wrong, but we do have an MOU that outlines some of those parameters under distance learning. And so that's good. There's standards in the state. There's instructional minutes. There's a lot of things that did not exist before that we now have. And so beyond that, we do expect our administrators to, you know, monitor just like they would if it was in person. They do the same thing via Zoom. They obviously can't be everywhere. One of the things we don't necessarily want them tied being a sub, for example. You know, we want them doing their job as the administrator. That's where they're truly valuable. But more importantly, you know, if they're, like I said earlier, if there's something that is not up to par, by all means, say something. And I will share this. I've been a former high school principal for many years, and I hear the same thing that I hear from parents in this community. Well, I don't want to get the teacher upset, okay? And I don't want them to, you know, get angry and take it out on my kid, you know? And I know those thoughts go through every parent, but, you know, in all fairness to the teacher, you know, have that conversation at the appropriate time. And, you know, I think our teachers are very much open for that feedback and willing to make adjustments for the kids. But it starts with a very open conversation, okay? So I do encourage everybody to do that, to have those conversations, okay? And Leona, I know you had your camera on, so I get the sense you might want to add something to what I shared.
No, I was just ready.
Okay, all right.
Okay, thank you. And I think that's really important for parents to know, that they need to let the principal know if something is not right.
That's the way, but I always encourage, talk to the teacher first. Give the teacher an opportunity to fix it, make it right, or explain.
Okay. You know, we've heard a lot of comments, and like I said, this is really difficult, but I've heard, you know, can we give more local control? We are the local control. As you said, Mr. Lee-sung, we are the local control. The buck stops with us. I've also heard from parents, individual parents, We don't need mental health support. We don't need transportation. We don't need nutrition services. We just want our kids to be in school. I understand everybody is looking out what's best for their student, for their children, and I appreciate that. I would be doing the same thing, but we have to look at what's happening in the totality of the district. And that's why, you know, the operations of the organization, how are we gonna get through that? So I think that's why we're here tonight. The mental health of students is really important. I think we have a great support team through Dr. Jacob's office, and for sure Dr. D'Agostino does a wonderful job with that. And I know they will continue to support the students. I know we'll get to the motion soon. I do just want to reaffirm that we are making a commitment that if we do this, go to distance learning for 3 weeks, that we are firmly coming back on the 25th, that we are making that decision, we are coming back. Hopefully by then, everybody will have done their job in terms of distancing, taking care of themselves, recuperating if they've been sick, whether it's with COVID or the flu or a cold, and they can come back strong. But I think we need to make that commitment that our secondary students will be back on the 25th. And I just wanted to, and I think it's important, and Trustee Metoyer touched on this, but I don't know how many of you, I know a lot of people are on the email from the CEO of Hogue, Robert Braithwaite, and he just wrote something this afternoon, and I just wanted to read part of it because I think it's really important. He said, as you may have heard, COVID-19 cases continue to rise sharply in our community. Today, we had the highest number of people hospitalized at Hogue with COVID-19 since the start of the pandemic. The clinical teams are doing an exceptional job for caring for every patient that comes to our hospitals, urgent care centers, and physicians' office. I am writing to ask each of you to do your part to curb the rise in cases. At this point, we all know what to do. Stay home as much as possible. Keep your mask on when you are out and refrain from gathering, including holiday parties and gatherings that we all yearn for, but know we should not host or attend. It is a sacrifice, and a year of sacrifices, this one can seem hard to make. But in the season of goodwill, I ask that you practice the compassion and kindness to others that staying home represents. Your actions could make all the difference. And he goes on, but I think it's really important that we all remember that. I think it's a great message. And I really, you know, I do want everybody to have a happy holiday out there, but I think they need to be cognizant of this because the only way we're going to be able to have all our students on campus is if we just follow the guidelines. So with that, are there any other comments, or would someone like to make a motion?
Can I make a comment?
Sure.
Yeah. I think, you know, I try to take a really fair and open-minded approach to the facts. And I thank everyone for everything that's been presented. And I just would say that if you're a teacher and you're paying attention, if coming back from this, you know, my goal would be that people would come to distance learning and go, well, wow, this really this worked so much better than before. We tried. And I think we're all so exhausted. And I think that our students are exhausted. And I know that my own children are just done with Zoom. You know, it's hard to even get them to sit there. But I think just doing our best to provide the most engaging content. We're at the beginning of a semester, really helping where we can is one other thing we can do. And hopefully staying home over the holidays makes this even shorter than we're thinking. But, you know, the criticism I'm hearing is people want kids in school because Zoom's a bad format, but also because kids aren't learning. So, you know, I don't know how we need to work together to fix that, because I think that we need to be focused on that as much as protecting our community and being safe.
Thank you. I think that's important. So, Trustee Metoyer.
Thank you. Of course, I put all my paperwork away, but I will move that we support the motion put forth by the staff.
A second.
Oh, I'm sorry.
Wake up.
We have a motion to approve temporary shift to distance learning for all secondary schools, grades 7 to 12. We have a motion by trustee Metoyer, seconded by, I'm sorry,
It was
trustee Ursulou. And we'll have a roll call vote.
Trustee Yelsey,
Yes.
trustee Barto,
Yes.
trustee Matoye,
Yes.
trustee Anderson,
Yes.
trustee Crane,
Yes.
trustee Ursulou,
yes.
trustee Wigand.
No.
The motion carries 6-1. And Mr. Lee Sung, you will take the necessary steps to inform everyone.
Yes, we will. We'll send a message out tomorrow. I think that's a very important part of this decision. I thank the trustees for obviously very seriously considering this from all perspectives and giving us clear direction to send this message. Thank you.
Okay. If there are no further comments, I'd like a motion to move to adjourn.
Oops. So moved, and I wish everyone a happy winter break.
Second?
Second.
Second, moved and seconded. All in favor, we'll just go that way.
Aye.
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 Thank you very much.